Welcome to LANS, lectures about nursing concepts and examinations. Hey everyone, welcome back. If you're new here, I'm Lance, and I help nursing students like you survive nursing school and crush your boards, whether that's the National Licensure Exam in the Philippines or the NCLEX-RN in the USA. Today, we are tackling a topic that is more relevant than ever. We live in an anxious world, and as nurses, we are going to see patients with anxiety disorders on literally every unit. Not just the psych floor, the ER, the ICU, even in the medical surgical unit. We're going to dive deep into anti-anxiety medications or anxiolytics. We're going to pull out exactly what you need to know for the board exam and more importantly, for when you have a real patient in front of you. So grab your highlighters and your caffeine and let's get into it. Before we talk about the drugs that fix anxiety, we have to understand what's broken. Anxiety is a feeling of discomfort and apprehension that can range from mild, that pre-exam jitter, to panic where you feel like you're dying. Anxiety isn't just being nervous. It's a complex neurophysiological state. Think of your brain like a car. You have a gas pedal, and that's your norepinephrine and sympathetic nervous system, the fight or flight. And you have a brake pedal. That's your GABA system. GABA, or gamma-aminobutyric acid, is the brain's primary inhibitory neurotransmitter. It slows down the neuronal firing. It's your natural chill pill. In anxiety disorders, the brake pedal is weak. There isn't enough GABA activity, or the receptors aren't sensitive enough. So the gas pedal, the norepinephrine, the cortisol, etc. runs wild. So what's the job of anxiolytics? They strengthen the brakes, or in other words, they potentiate your GABA. Let's look at the main classes that does this. The benzodiazepines and the non-benzodiazepines. Okay, first up, the most famous class, the benzodiazepines, or benzos. These are your frontline drugs for acute anxiety and panic. You'll see them on the floor as PRNs all the time. They can also be prescribed for alcohol withdrawal and status epilepticus. And here are the major players, the common drug names for the benzos. First, the short-acting triazolam, which is usually prescribed for sleep. Then we have the intermediate-acting Lorazepam and Alprazolam. These are workhorses for acute anxiety episodes. And lastly, the long-acting ones, which include Diazepam, chlordiazepoxide, and clonazepam, which are famous for muscle relaxation, for alcohol withdrawal, and seizure prevention due to their steady, sustained effects. As I've said earlier, benzos strengthen the brake system. Benzodiazepines enhance the effect of GABA at the GABA receptor sites. Benzos don't create GABA. They potentiate the effects of GABA. In other words, they increase GABA's efficiency at the receptor sites. Now, this is a clinical pearl. They work fast. Patients can feel the calming effects within 15 to 60 minutes when given orally, and 15 to 30 minutes when it's given intramuscularly. And it can even be as quick as 5 minutes when delivered intravenously. That's why nurses and patients love them. But it also means we must be cautious of their side effects. The big one is central nervous system depression or CNS depression. Think confusion, no coordination, or ataxia, sedation, and drowsiness. You must educate your patient to avoid driving or operating heavy machines until they know how this drug affects them. Fall risk is high. In the exam, your priority nursing diagnosis is risk for falls. Now, the number one safety warning: do not mix with alcohol or opioids. This is a potentially lethal combination. Both benzodiazepines and alcohol or opioids are CNS depressants. Together, they can stop your patient's breathing. This is a non-negotiable patient teaching. And also instruct your patient to not stop benzodiazepines abruptly, as these can lead to seizures. Benzos also cause tolerance and dependence, meaning the body develops tolerance quickly, requiring higher dose for the same effect, leading to physical dependence. This is why benzos are usually prescribed for short-term use only, which is around 2 to 4 weeks. Lastly, the antidote for benzodiazepine overdose is flumazenil. Remember this, it's a competitive antagonist at the benzodiazepine receptor. And that's benzodiazepines. Now let us talk about a drug that is completely different. It's not a controlled substance, it doesn't cause sedation, it's not addictive. I'm talking about Buspirone. No sedation, no cognitive dulling, no risk of dependence, and no potentiation with alcohol. This makes it a much safer choice for long-term management of anxiety disorders. Unlike benzos that work on GABA, Buspirone is a partial agonist at the serotonin receptor. It's kind of like a mild antidepressant in its action. It modulates serotonin activity to reduce anxiety. The onset of action is the most important teaching point. While benzos work in minutes to hours, Buspirone takes 2 to 4 weeks to work. They are not prescribed for immediate anxiety relief. They build up in the patient's system over time to prevent anxiety. It's great for generalized anxiety disorder, the chronic, low-level, always worried type of anxiety. It's not effective for panic attacks, and it's not used as a PRN. Now let us compare them side by side. Benzodiazepines have a rapid onset, there is a risk of dependence, and they cause sedation, while non-benzodiazepines have a slower onset, but they cause no dependence, and there is minimal sedation. Now, for a quick lightning round of other drugs you'll see used for anxiety, even if that's not their primary indication. Antihistamines. Common drug name, Hydroxyzine. Often used for mild anxiety, especially preoperatively or in patients with a history of substance abuse where you want to avoid the addictive benzos. It's a safer, non-addictive alternative. Nursing consideration, it causes sedation and anticholinergic side effects. Beta blockers. Common drug name, Propranolol. Indicated for performance anxiety. Think of a musician scared to go on stage or someone terrified of public speaking. It works by blocking the physical symptoms of anxiety, the rapid heart rate, the tremors, the sweating. It doesn't change the mental feeling of anxiety, but if your heart isn't racing, you might feel more in control. Common side effects include hypotension and bradycardia. Nursing consideration, monitor the patient's blood pressure and heart rate. Antidepressants. Common examples are escitalopram, sertraline, and duloxetine, which are classified as SSRIs and SNRIs. For more detail on this, see the lecture on antidepressants. Alright, future nurses, that is the end of our lecture on anxiolytics. If you found this video helpful, please hit that like button. It really helps the channel. Subscribe so you don't miss our next lectures about board exam favorite concepts. Drop a comment below. What is the most challenging part of psych meds for you? Is it the side effects, the mechanisms, the drug names? Thanks for watching. Good luck with your studies, and I'll see you in the next video.